overnight or in a very short period of time, a miracle happened and the cancer was cured?
Here what happens in cancer itself, an organ itself has failed. And if it has spread too much, then definitely miracles can't happen. Once the cancer is at an early stage, definitely miracles can happen.
And what are the scientists working on today?
So scientists are working like that, how the treatment of that cancer can be reduced. Suppose the cancer has been already gone for stage 4, which cannot be treated. Scientists are working on how the life can extend in this case.
How many types of cancer are there, and what's the most fatal one, and what's the easiest one to treat?
That like you see from head to toe, it's simple. Wherever the abnormal cell will get collected, the cancer will be there. Because of the scare of chemotherapy, surgery, radiotherapy, they avoid cancer treatment, and then the cancer becomes death sentence for them. Participate in healthy lifestyle screening programs and be positive during the treatment. And if the people are working, they should not stop their treatment work going to offices during treatment. I never want to give a sick leave to the patients. Our sick leaves will make them more sick.
Best greetings of the day, everyone. My name is Wagida, and I would like to welcome you all to a brand new episode from Podcast with Wagida. I thought I'll start this episode with a joke to lighten the mood a little bit before revealing today's topic. But unfortunately, I could not find something that would be compassionate enough or sensitive enough to make up for the dreaded disease that we are going to discuss with the expert in today's podcast. It is that unkind that in certain cultures, in some countries, they don't say its name, they avoid it. They would go about it to say things like المرض الخبيث, which means in English, the malignant disease. In my country, Egypt, we say المرض الوحش, which means in pure English it says the bad disease. However, in this peculiar context, it means the nasty disease. I think most of you knew what today's podcast is about. It's going to be about cancer. There, I said it. It is about cancer. We're going to talk about the causes of cancer, types of cancer, mutation of cancer, what we can do to avoid it, even if we don't have it running in the family. It doesn't really matter. Not because people are born to a family that have history of cancer, they will have cancer. And not because you're coming from a cancer-free family, it means that it will never ever visit you. That's exactly why we have today's expert with us. With his 23 years of experience, he's going to share his knowledge with us on how to do the tests, where to do it, when to do it, who needs to do it, what to watch for, what we can do in our lives in order to avoid having cancer. Today's guest is Dr. Pranay Taori, who happened to be the oncology specialist in Aster Hospital. 23 years of experience. Dr. Taori is a member of American Society of Clinical Oncology, and he's also a member of European Society of Medical Oncology. With that, today he joins us in order to untwist so many of the misconceptions and the wrongly perceived information about cancer, cancer treatment, cure and prevention. So please join me in welcoming Dr. Pranay Taori. Dr. Taori, thank you very much for joining us today. Really appreciate it. Now, we know that oncologists are very special people, very special individuals. Not anyone and not everyone can just study and become an oncologist. The reason is that dealing with cancer can be emotionally and mentally challenging and draining. And it takes a lot of compassion and I would say empathy and a different level of communication for a human being to be able to address these challenges with the patient or the patient's family, because it's not an easy thing to tell someone, you have cancer. So with this, when was your first time in your career that you actually had to tell a patient or the patient's family that the patient is facing mortality and that the patient is actually living on borrowed time?
We don't tell the patient directly because the relatives don't want patients to come to know that they are going to die. As far in Western countries, the difference is they want everything to be talked to the patients first. Transparency.
Yeah.
So I used to talk to the relatives. I used to tell them. Then definitely the relatives will break. But by the time the patient becomes sick and becomes on deathbed, the patient general condition keeps on deteriorating. So we keep on making their mental preparation. It's not on one day only we'll directly tell. We will keep on telling them that no, today this is sinking, tomorrow this is sinking, this is happening. So they get mentally prepared. We make them prepared for the worst, and then we break the news to them that your patient is pretty sick, nothing much can be done. And we have a facility of hospice back home in our countries those days. Now also hospice is there for terminally sick patients. So we will refer them to hospice telling that now nothing much can be done. So please go there, keep the patients there or do the home services, get home care for the patient. Definitely it's a tough job, not like other professions. It is mentally draining.
Yeah.
It needs a lot of patience to talk to the relatives. And one more thing is there. Back home what happens, and here also, lot of relatives are coming when the patient is sick. So one relative will come, they will ask same questions. Then second one will come, again they will ask the same things. So there is the test of time, because the same negativity you have to keep on passing to multiple people. Despite we are told to 10 people, 11th person will come. So these all take the mental stress, they take the toll. It is little bit exhausting, but with time you learn.
Of course.
This doesn't come by books. Reading oncology by books is not possible. This I experienced recently when my mother had a breast cancer. That about in 2022. It is a very early stage breast cancer. I knew nothing very difficult. But still, I was as a son very tensed. And that time, I really wanted some empathy, some compassion from people around. That time, I could learn what oncology is. I could put myself in the shoes of patients. And then my training in oncology was complete.
The patient's family. And the patient and being
a
patient's family.
Patient.
Definitely. Well, hats off to you, doctor. That's what you just said is the reason why not every single person can just wear a white coat and become oncologist.
Reading books will just give you a degree. Reading books will just give a degree.
Yes.
But with time, and oncology is nothing but an extended secretary. We have to read the minds of people, minds of relatives.
Yeah.
And we have to know what's going on in their mind, and as per their intellectual level we have to talk to them. Suppose there
Which
is
a challenge.
Yes. Suppose there is a patient with a rural background. Definitely here in Dubai I get a lot of educated class, but back home we get patients from rural background. There we can't talk about medical science, trials, survivals, all those academic jargons we can't tell. We have to tell in their language.
Yeah.
So that is also a trick. Here there are multiple nationalities coming to us. Sometimes whites are coming. Sometimes Arab people are coming. Indians are coming. Filipinos are coming. So in that case, The problem is multiple nationalities have got multiple ways of behaving, different type of cultures they are. So here I learned to tackle with each nationality in different way. So it is never an ending.
Yeah.
It is always a
Yeah.
learning. We might have learned books, but this part of learning is very tough. And I think it will continue till the end of our career.
Indeed it is, and you will continue learning every day. But what you said, Doctor, brings me to this very urgent question. Many nationalities are coming,
Yes.
and you see loads of them every single day in and day out. The question is, do I link a particular type of cancer or a specific mutation of cancer to a certain country or region? Like this type is so prevalent in this country or is prominent in this region?
We are having a very short number of patients from particular nationality. So we can't tell that this nationality has got more, this nationality is less. Unless we go and practice in particular countries, then only we'll come to know. But definitely as a whole, in white people, we have more of skin cancers, more common. Skin cancers. And here if you see in higher socioeconomic status people, we have more of a breast cancer. And if you go with a lower socioeconomic status, cervical cancer is also one of the very important cancers, which I am of late finding here.
What causes cancer? Where does it come from? Like how does someone wake up in the morning and this person's got cancer?
Cancer can be due to external factors like ionizing radiations, carcinogens, viruses, or can be some inherent defect in the genetics. So what happens actually, what is cancer? Like in society, there are some erratic people, those who don't behave as per the norms of society, and they become cancer for the society. Same in the body. The cells are constantly dividing. If you have learned biology in your student days, constantly dividing, multiplying, and then getting died off. But that cycle is broken because of the genetic defect in the cells, or because of the ionizing radiation or external factors like carcinogens, ionizing radiation, ultraviolet lights, and some viruses. They damage the DNA of the cells, and then cells start, either there is inherent damage or external damage, and then cells start multiplying in an erratic way. And they get collected in particular part of the body, and that is called cancer of that part. So suppose the abnormal cells are collected in breast, that is called breast cancer. Suppose the abnormal cells get collected in the cervix, it is called cervical cancer. Any part of the body where I have a lump, suppose this lump has got all the normal cells that we can see in pathology. When we remove and see under the microscope,
Yes.
then it is not a cancer.
Yeah.
But when I have a lump,
Benign tumor.
and when I lump and then I remove,
Yeah.
my pathologist sees that these cells have got some erratic features, then it is a cancerous cells. So that diagnosis for cancer is by pathology, and that is seen by properly examine specialties that they examine, see whether. That's why whenever we are diagnosing cancer, we are doing biopsy, and till the biopsy results come, so you don't comment anything. So hence, why cancer happens is because of the damage to the DNA, intrinsic or extrinsic damage to the DNA of the cells, which cause abnormal growth of cells. And these abnormal growth of cells, when get clustered, they form cancer. And speciality of this cancerous cell is, suppose they are collected in the breast, they are very loosely attached to each other. So in the bloodstream they can flow, and once they flow in the bloodstream, they can go and survive anywhere. That's why the breast cancer cells can move in the blood, and they can go and harbor themselves in the liver or lung, and this we say that is a stage 4 cancer.
Would that be the metastatic cancer?
Yes.
Oh.
That is a metastasis.
Okay.
The normal cells, they are very much clustered to each other, but abnormal cancerous cells are loosely attached. And then when they are loosely attached. Slowly they will shed in the blood, and from breast they will go to liver, lung,
Move from
brain,
one part to
and
the
then
other.
from that they will form what is called as metastasis.
How many types of cancer are they, and what's the most fatal one, and what's the easiest one to treat?
See, cancer is a very big book.
Of course, I had
can't
the
tell that like you see from head to toe. It's simple. Wherever the abnormal cell will get collected, the cancer will be there. It may be in the eyes, it may be in the lungs, it may be bones, it may be in the mouth, oral cavity, everywhere. The most fatal cancer, what I feel, is the brain cancer. If it is the cancer isn't gone, if it is primarily started from the brain, or some cells from other cancers have moved into the brain, as I said, because the cells are loosely attached. Suppose some from breast has gone to the brain, or from lung has gone to the brain. So then the cancer is very bad. Mainly neurology and oncology combination is bad. If suppose cancer has gone to brain or it has started from the brain, it's not a good thing.
Challenging. Extremely
Challenging means we have to tell patient clearly, and that is the most difficult thing to explain also.
What would you say is the easiest cancer to treat?
Easiest cancer to treat, which I would like that it should come in my OPD, is the breast cancer.
The easiest to treat.
Easiest to
like
treat,
straightforward.
Yes, straightforward. And what happened is like what I studied during starting of my career in breast cancer is totally different now. So a lot of research has been done, and with that research in breast cancer, actually breast cancer numbers are so high. So any research is first done in the breast cancer, and then that research is extrapolated to other types of cancers. So breast cancer is a big science, and where we actually have got the results, because lot of research has been done because of lot of numbers of breast cancer. Like each woman in her lifetime, like 1 in 8 ladies, normal ladies, will develop breast cancer. So any lady has a risk of, suppose 8 ladies are standing, out of that 1 lady is at risk of developing breast cancer.
1 in 8.
1 in 8. And as the age goes on advancing, the breast cancer risk increases. So you can imagine how many breast cancer patients are there. So research is very good, and then awareness is very good, and we can detect breast cancer at an early stage.
How?
Screening programs are there. There are screening programs
for who
of breast
and
cancer.
for who, doctor, and when? Like is everyone, let's say, sitting in the studio today, or everyone watching us at the moment, is there a specific age, a specific like signs, people with a specific lifestyle are more prone to having cancer than others? When do I go and start to do tests and screening for cancer?
In this part of world, after the age of 40, every year a lady should undergo mammogram. Mammogram. That's why October month is celebrated as a breast cancer month, and there are a lot of campaigns done in this month to do the mammogram.
Yes.
What happens? What are the signs and symptoms which will make us feel that we have developed cancer? But by the time the signs and symptoms develop, the cancer is no more an early stage. If you wait for the breast lump to come, if you wait for bloody discharge from the nipple to come, if you wait for distortion of the breast to come, that means cancer has advanced. If you wait for the lump to be palpable. What does this screening do? Screening picks up the breast cancer when it is not even palpable. 1 centimeter lump in big breast, any breast, is not, no clinician can palpate. So that 1 centimeter lump only can be detected by our techniques, mammograms and all. And with this awareness, we are finding breast cancers at a very, very early stage.
How about the other types of cancer, like brain?
I will tell you about breast cancer.
Yeah.
And if we find if we should not wait for symptoms to come for breast cancer. we should go for regular screening. And if we find doubtful lump in the breast through mammogram, we should evaluate it and get yourself investigated. Because in screening, we are detecting in asymptomatic patients. And if you detect a breast lump in asymptomatic patient, it must be pretty early. So result, survival will be better in that case. Recently, one of my friends' mother-in-law came to Dubai just for a visit. And then my friend's wife told for her mother that they want to just get a screening done. In the screening, they found that there is a breast lump. That lady didn't have any symptoms, nothing. And breast lump, they found that was 1 centimeter. And that breast lump was immediately operated by an oncosurgeon. And because it was an early stage, that lady is fantastically fine. Same thing happened with my mother also. We detected at a very early stage just because we are doing mammogram. My wife is a radiologist, she did the mammogram.
Yeah.
Definitely, but I being an oncologist still in my family, this practice is not there till now to do every 40, after 40 every year. They don't do. Somehow ladies are apprehensive to do the mammogram at the age of 40 and after 40. But my suggestion would be we should, like ladies are having a regular habit of going to parlors and having a very cozy life. So include this thing
This
also
is
in your
true.
lifestyle.
This is very true. Yes.
Make it as a habit that after the age of 40, you will go for mammogram every year. And if you have a family history in the breast cancer, suppose you have your first degree relatives having breast cancer, or 2 or 3 second degree relatives are having breast cancer, or some male members in the family are having breast cancer, those people should get screened at a little early age, like 35 years only.
What else could be screened,
Huh?
doctor? So far, we're covering female.
Breast.
With the
Second
breast
cancer to be
cancer.
screened is the cervical cancer.
Okay, and this is for what age? I fully understand that for those that have history in the family of cancer
Cervical
cases.
cancer doesn't run in the families. It's because of the viral infections.
Okay.
HPV virus. So normally the vaccination programs are there for cervical cancers.
Okay.
And but still those ladies should be going for every 3 yearly pap smear after the age of 20. Once they become sexually active, after that by the age of 25, normally every 3 yearly pap smear has to be done with the gynecologist. And then if there are any atypical cells seen, then they should go for HPV studies, viral studies. So in that way we can detect cervical cancer also early. Cervical cancer is every 3 yearly. It's not every year because that virus grows very slowly.
I got you. Right. And how about men?
Men,
Nothing to be
see, I'll tell you one
screened?
thing. For men, we have got one cancer is colorectal cancer. That colon cancer, rectal cancer is there in men and women. So all the people above the age of 50 normally should go for stool for occult blood testing every year. Every year they should go for stool for occult blood testing. And in that stool, if you find any blood, then they should consult a gastroenterologist and get colonoscopy or endoscopies done and check whether they have a cancer, because it will be also an early stage. Again, colorectal cancer runs in the family. If you have a family history of colorectal cancer, then definitely the screening should start at an early age.
And does my lifestyle, the environment around me, my diet, or let's say how active I am or how lazy I am, the food I eat, the air I breathe, any of these things can actually accelerate the development of cancer, or
No, definitely.
Not really.
Today's lifestyle can accelerate the development of cancer.
such as what? What are the main
Adulteration.
things that?
Adulteration in the foods.
Okay.
Then second thing is unhealthy lifestyle. Lack of exercise. We are become couch potatoes. So most of the people are not moving out of the chairs because of their jobs. And like what used to follow, like early dinner and early sleep, that all matters. and healthy lifestyle has to be there to prevent cancer. Definitely, cancer can happen in normally people who are living
Healthy
healthy,
people, yes.
because there are other
yes.
factors like genetics also associated with the cancer.
Yeah,
There may
yeah.
be some genetic defects, so for which nobody can help. If a person has got a genetic defect and has got again habit of smoking, then definitely they will have a lung cancer. But if they stop smoking or they avoid smoking, so despite of the genetic defect, the cancer may come little late or may not be that aggressive. It is a two things. If you have a genetic defect and you are putting external factors also together, so they will add up.
So did you have a case that you got to a phase where you had to declare to the patient that it is a mortal phase, and overnight or in a very short period of time a miracle happened and the cancer was cured? Did it ever
I
happen
always tell
before?
patients there is no miracle in oncology. Because what happens in cardiology and all and other specialties, part when vessel is blocked, you just do the stent, patient is all right. Here what happens in cancer itself, one organ itself has failed. And if it has spread too much, then definitely miracles can't happen. Only thing what can prevent cancer is our healthy lifestyle and getting yourself actively involved in the screening programs. Get yourself checked, be aware about cancer.
Yeah.
If you have a suspicion of cancer, get yourself screened and go to the doctor regularly after a particular age, and see to it that your cancer is detected at an early stage. So once the cancer is at an early stage, definitely miracles can happen, because early stage cancer, any cancer if is detected in an early stage, chances of cure are very high. But we see that cancer patient is already bedridden, it's advanced cancer, so no miracles are happening in oncology. These are preached by a lot of babas and all, that we can put some miracles and all. But I can always vouch that miracles can't happen in oncology.
Indeed, and as miracles cannot happen neither in oncology or I think any other field, I would say
Miracles
there
can
are...
happen definitely in other fields. Like suppose some patient is having infection and patient is very sick. Definitely with good antibiotics and all, the miracles can happen there. Where you have already lost hopes, miracles can happen. Cardiology, when you see that patient is, I've seen patients ECG is a flat line. Suddenly they do and go for angiography, angioplasty they do, and it's miracle happens. But such type of miracles don't happen in oncology.
And what are the scientists working on today?
They are working on today on immunotherapy, targeted therapy. They are working on, suppose there is genetic defect, so they are trying to address the gene which is defective. On those things the scientists are working, and it's like simple. What cancers were curable? Suppose one cancer is curable, like 20 years back that cancer was curable. So that patient is cured. So scientists are working like that, how the treatment of that cancer can be reduced. Because long-term side effects of that cancer treatment should not come in the patient. Because suppose a 10-year-old child is there, he has developed a cancer. He is getting treated. He is cured. When he becomes 30, because of excessive treatment at the 10 years of age, he should not have that long-term side effects. So in that case, in curable cancers, scientists are working and decreasing the cancer treatment so that long-term side effects of cancers are not there. But suppose a cancer is not curable today, the scientists are working how it can become curable. Suppose the cancer has been already gone for stage 4, which cannot be treated, scientists are working on how the life can extend in this case. So for different cancers, like stage 4 cancers, people are working on targeted therapy, immunotherapy, which was not there before.
Yes.
For early stage cancer, people are working like breast cancer. If you see, initially the treatment of breast cancer was just removal of the breast.
Yes.
And that patient will survive whole life.
Yeah.
But whole life, without breast, if the patient is moving, they will have a psychological effect.
Exactly.
So people are working on it, how the breast can be conserved. Understood. That anyway, now the breast conservation has come. Then after that, like, you have done one good thing, we want to extend more and more better.
Yeah.
Like suppose the deathbed is there, any medicine can at least not cure him, can prolong his life. Like that, incurable cancers like breast cancer, people want, patients are going to survive, as I said.
Yes.
Early stage.
Yes.
But then when they survive, their quality of life should be good. They should not be depressed because lack of breast.
Yeah.
So people are working on that factors. Whether the treatment can be customized or reduced. Suppose some cancer is not curable, people are working how in this cancer a good drug can give a good quality of life to the patient. Understood?
Yeah.
So like that, people are working on different aspects.
Yes. So basically, cancer treatment can get to a stage where it can leave the patient cancer-free but suffering other consequences or other side effects of the treatment and the prolonged treatment.
Yes. Like I'll give an example. Like children are there. Normally, the pediatric cancers are most curable cancers. Like almost all the pediatric cancers are cured if they take proper treatment. But problem with this treatment is because the treatment is given in a very early stage of life, and they are cured, they become adults. So with this treatment, there is a long-term side effect.
Yes.
So to prevent that long-term side effect, how we can decrease the treatment duration?
Yes.
We are finding that.
Yeah.
Like suppose in acute lymphoblastic leukemia in the pediatric cancers, we are giving radiotherapy to the brain. So if you give radiotherapy to the brain, definitely the cancer will come down. Okay. But at the same time, in long term, there may be some cognitive defects in the child. So people are working on that, how to decrease the intensity of treatment so that the child will survive, but side effects, long-term side effects of the treatment won't be there. Got my point?
Yes.
Suppose one child is treated and we give her treatment, chemotherapy. He survives, but he becomes infertile. The people are finding that.
Oh dear.
Because long-term survivor, these problems will come. The people are finding.
Treated something and then we'll have to treat.
People are finding which chemotherapy will make patient less infertile. Initially, on Hodgkin's lymphoma, they used to give radiotherapy full to the chest and all. So what happened in long term, patients used to survive. But because of the radiation, they used to develop thyroid cancer. When they used to grow, like suppose 10 years old child has developed Hodgkin's, but at the age of 30, they will develop radiation side effect, long-term thyroid cancer. So now they have studied that how to reduce the radiation field, whether we can discontinue the radiotherapy in Hodgkin's. Like that. Suppose you have given the cure. Once you give the cure, they want that the good quality of life also should come to the patient. So that way, research will never stop.
Of course. This is great news. This part of the questions has finished already, and I would like from you to look at the audience and the viewers at the moment and give them a message on how to take care and how to look after themselves and things related to prevention is better than cure.
Prevention is better than cure, but still I can't guarantee anybody that they will be 100% free. That like a lot of patients are coming that they don't take drinks, they don't have non-veg, they do regular exercises, everything, but still they develop cancer because there is something inherent inbuilt. Understood? But to prevent cancer, they should have a healthy lifestyle. One important thing, diet should be good, high protein diet should be there, and less of alcohol consumption and avoid cigarette smoking. Most important thing is that they should participate in the screening programs for whatever cancers are available, like colon cancers, breast cancers, cervical cancers, prostate cancers. But prostate cancer is also one of the good cancers where it happens in the old age. And normally, these is very slow growing. Patients survive well. Even in the stage 4 prostate cancer also, survival is good in prostate cancers. It is in the males, prostate cancers.
Finally, some good news are arising. This part, doctor, is about this or that, in your opinion. We are going to start with surgery or radiation therapy for early stage cancer.
It's never like surgery or radiation. If it is a very early stage, surgery is the best treatment. But if it has locally spread, then definitely radiation is also important part of treatment. There is nothing like this or that. It is always a combination. If it is locally, like suppose the breast cancer is a very early stage, but you have not removed the full breast, then radiotherapy will also come after surgery. But suppose the breast cancer is like locally spread, then after the surgery, definitely radiotherapy will come even if you have removed the full breast, because it is local spread. And early stage means it is not locally entangled the lymph nodes and all.
Chemotherapy or immunotherapy for advanced cancer?
See, immunotherapy has got totally different concept. Immunotherapy means these are the injections, these are the drugs which will change the immunity of the body, and that immunity will kill the cancer cells. In some cancers like renal cell carcinoma, hepatic carcinoma, immunotherapy is very much important. But in some cancers, chemotherapy is very important in advanced cancer. In some breast cancers, immunotherapy with chemotherapy is important. So that's a big science. We can't say this immunotherapy or chemotherapy. It is either or no, it's not like that. It is either a combination, or in some cancers it's only chemotherapy, in some cancers only immunotherapy, or like in renal cell carcinoma or hepatic carcinoma, it's only immunotherapy. In triple negative breast cancers, it's immunotherapy with chemotherapy. In lung cancers, it's immunotherapy with chemotherapy. In particular type of colon cancers, it's only immunotherapy. So it is neither like only immuno or chemo. It's always a combination.
So they go hand in hand?
Hand in hand, or depends on our research. Some cancers need only immuno, or some cancers need only chemo, or some cancers need combination.
Brilliant. How about traditional medicine or alternative therapies for managing the cancer symptoms?
See, I'm not an expert in that, alternative medicines. I've seen a lot of people giving alternative medications, but normally whatever research has been happened in oncology in our side is much ahead of these alternative medicines. These people will come into play when cancer is very advanced, and they will give some hope to the cancer patients.
Yes.
Where we tell there is no hope, there those people come in the picture. That's what I've seen. But I don't have much of knowledge about alternative medicines.
Okay. If I say hospital-based cancer treatment or home-based cancer treatment?
If you want to go for an actual cancer treatment, it should be hospital-based. But suppose the patient is very sick where cancer treatment is not possible, then definitely home care is there, where nurses will visit homes and give some IV fluids, painkillers. But proper cancer treatment, radiotherapy, surgery, chemotherapy cannot be home-based. It has to be
hospital-based. Seeking a second opinion from another oncologist or other oncologists, or just focus on the oncologist that you receive the first diagnosis with?
Normally, it is not possible. Psychologically, no patient will accept in one go that they have a cancer. Whatever patient comes to me, they will take my exam. They will go to first other oncologist, second oncologist. They will keep those reports hidden. They will listen what I am telling. They will compare if I am correct or not. Then if they are satisfied, they will come to me. And that is no wrong, because it's a dreadful disease. Even if you are going to purchase small thing in the mall, we are seeing for 10 people, 10 things. Some small grocery item also we are searching a lot. So this is their life. They have a right to take multiple opinions. and whatever suits them, they will go.
Yes.
But definitely, people are quite intelligent. They read Google. They go to multiple doctors. They also come to conclusion. We can't befool them. And after that, they come to a doctor. And that is their right.
Of course.
Everybody should take a second opinion. I would suggest all patients of cancer should take a second opinion. It's not like they should rely on one. Because doctors no more are gods. We are also human beings. We may make mistakes. My suggestion is always take a second opinion. There's no harm.
Yes, definitely. Common part is called myth busters. Basically, we grew up hearing these things and we believe they are right and we keep repeating them without actually investigating whether they're right or not. Now that we have the expert sitting with us, I'd like to explore some of them with you, doctor. Chemotherapy always causes hair loss.
Definitely chemotherapy causes hair loss. Bad news. And definitely it is very difficult for ladies to digest that fact. All chemo drugs may not cause hair loss, but 90% of chemotherapy medicines will cause hair loss. But I always give an example. If you are given a choice for a lady to choose between life and beauty, what they will choose?
Life.
Life. So that way I tell them that chemotherapy may cause you hair loss, but this life is only once.
Yes.
This hair will come back again.
Yes.
One more myth is there that permanent hair loss is there. But it's not a permanent. Once you finish chemotherapy, hair loss factor is gone. They will have very good hair.
It grows back. Yeah.
Grows back.
Okay.
But once the cancer has spread, it won't come back to normal. So that I explain to everybody that hair loss, don't be afraid. And nowadays, I think when patients are told for chemotherapy, they are very much aware that they will lose hair.
Yes.
So they don't worry about too much in front of me about hair loss. Understood?
Yes.
Back home in India, definitely people are more worried about hair loss.
Of course.
Because they don't Google. But here they are Googling a lot.
Yeah.
So they are okay with it. They take it positively.
Yeah.
They are concerned of some other side effects. Like in Google, there is written lot of side effects. In the end, there is written death. They think that if they take chemotherapy, they will die. Or they think that chemotherapy is given because they are going to die. It's not like that. Chemotherapy is given only, suppose patient has early stage breast cancer or any cancer. We have done the surgery, but then we are giving chemotherapy so that the cancer doesn't come back. So that is not a death sentence. And neither that chemotherapy will make patient die.
Yeah.
In my whole career, I have not seen patients because of chemotherapy dying. But the rare incidences are always there. With that rare incidences, in Google it is written death is the side effect. But that patient sitting in front of me is not going to die. Which chemotherapy causes death is, suppose you are going to treat patient for acute leukemia. That acute leukemia chemotherapy is very aggressive, and that aggressive chemotherapy can cause death in the patient. There will take a consent like that. But all chemotherapy doesn't cause death.
And people also believe that radiation therapy is always extremely painful and causes severe burns.
Yes.
That is correct?
New machines have come, that burns have come down, but definitely there are burns. But ultimately, the chemotherapy side effects are little systemic, like hair loss, nausea, vomiting, weakness, backache. For ladies, I will always tell that they have a feeling of pregnancy. Like nausea, vomiting, change of taste. Accepting hair loss, all symptoms of pregnancy will come in ladies. But radiotherapy side effects are little local. Like if they are given, radiotherapy is given to the breast, there will be skin peeling. If they are given to the oral cancers, definitely there will be oral ulcers, difficulty in swallowing and deglutition in them. So definitely local side effects are more predominant in radiotherapy and systemic are there more in chemotherapy. But all these side effects are curable, treatable. That's what I'm telling. Side effect pain may be painful, but that pain is for a short while. But cancer is not for a short while. Just because of scare of chemotherapy, if you don't take or radiotherapy, you don't take radiotherapy or chemotherapy, the cancer will grow.
Yes.
And then we don't have any option for them. So this is the mistake which people do because of myths of chemotherapy.
Yeah. And another one that says, once cancer treatment is complete, you are cured and you will not need to see oncologist again because cancer is not coming back. Is this correct?
It's not like that. You have to regularly follow at least for 5 years with the cancer doctor. Like every 6 monthly, you have to get yourself checked.
So once cured, you'll still have to go for regular checkups.
Yes, today only one patient asked me, am I cancer free? CA breast case. I said, you are cancer free. At present, there is no cancer in the body. But whatever tablets we are giving, whatever treatment we are giving, whatever follow-ups we are doing is just to see it that you remain cancer free forever. Understood?
Yes.
So you can't take it lightly. You finish the treatment, at least 6 monthly once you meet an oncologist after finishing of the treatment.
People think that cancer is a death sentence.
That I have been telling again, same thing. Cancer is a death sentence provided you go for late stages.
But if caught up earlier...
But definitely, again, I will tell you, if you have a breast cancer, which is spread stage 4, still there is a treatment available, patient can be cured. If there is a testicular cancer, if it is stage 4, treatment. If you have a colorectal cancer, if it is stage 4, cancer can be cured. But that doesn't mean that you should make it stage 4.
Yes.
Understood?
Yes.
But most of the 4th stage cancers are really a death sentence. As I said, the brain tumors are a death sentence.
Yeah.
Advanced lung cancers are the death sentence.
Yes.
Understood? So it's better try to be aware of the cancer symptoms, go for a regular screening, get yourself involved in the screening programs, maintain a healthy lifestyle so that you will detect cancer at an early stage and it won't be a death sentence.
And the last one says, cancer mortality rate is higher among men than women.
Quite good. God is justifying more towards ladies in this case because their cancers are more curable. If you see breast cancer, ovarian cancer, if you see breast cancer, as I said, stage 4 breast cancer is also maybe curable. Ovarian cancer also is very much curable, chemo responsive. Cervical cancer up to stage 3B, we have got 60% survival. Locally spread cancer of cervical cancer is also very good. So definitely God has
favored women,
partial towards ladies.
Thank you very much, Doctor. Thank you for your time and thank you for coming and being with us and for all the tips and advices that you have given, and thank you for clearing some of the misconceptions about the cancer and the cancer treatments as well. Much appreciated. And also with this, I would like to invite every single person watching this video to leave question in the comment section below, something that you would like to know about from Dr. Taori, because you need to hear and ask about the questions and get the answers from the experts in the field, not from a friend said or just, my ENT doctor said. With this, I come to conclude this episode. And thank you very, very much, Doctor.
Lastly, I would like to say that don't be scared of cancer treatment, but be scared of cancer. What happens? People are not scared of, because of the scare of chemotherapy, surgery, radiotherapy. They avoid cancer treatment and then the cancer becomes death sentence for them. And participate in healthy lifestyle screening programs and be positive during the treatment. And if the people are working, they should not stop their treatment work going to offices during treatment. I never want to give a sick leave to the patients. Our sick leaves will make them more sick.
Couldn't agree more. They need to go back to normal life and know that this is something that is curable and they will
extra care should be given
to
the cancer patients. They should be made to feel normal.
Couldn't agree more. Thank you very much, Doctor.
Thank you.
Thanks a lot. Thank you very much, everyone watching, and I'll see you again in my next episode of Podcast with Wahida. Thank you for watching.